Springer. I'm one of the nurses in pre-op and recovery, and I'm going to talk to you a little bit about our crash carts, where they're located, what are on the crash carts, and how to use one. We have 4 crash carts. We have one here in PACU, one on Med-Surg, one in the ER, and one in our pain clinic. So each crash cart is fully equipped to run a code. They do remain locked and have a lock on them that's provided by pharmacy with a number on them. If you ever see that the tag is broken, you need to notify pharmacy. There is a piece of paper here with all the expiration dates, with all the items that are inside. Each day the crash carts are checked to make sure that they're operating correctly, that all the batteries are working, that nothing is expired. If in fact a code is run and we need the crash cart, we want to make sure everything is working 100%. So on each crash cart you will find a binder here, and it's got a checklist here inside that we look through each day and check off to make sure everything looks correct. There are some little crash cart flashcards in here if you felt like you needed to run a code independently until the ER doctor is able to arrive. The ER doctor's phone numbers and names are in each crash cart, as well as an on-call schedule. So that would be the first thing that would need to happen in order for a code to continue to run smoothly, is notify the ER doctor that's on call. Inside the book there is also a code blue record that anyone who shows up to the code can be a recorder, or it can even just be a plain piece of paper. But everything needs to be recorded. As long as you have a pencil, pen, and a piece of paper, everything should be documented. At the end of a code the following day or later that day, an incident report needs to be filed and submitted to a manager. On the crash cart here, you have all the equipment that you should need, as well as medications. So each drawer is labeled. There's emergency drugs. They're all sealed, and that's monitored by pharmacy. They check the expiration dates on those regularly. If anything is used on a crash cart, make sure you notify pharmacy so that can be replaced immediately. There are IV supplies, airways, fluids, paper, all the materials that you need, gloves. You pop this open, and there are ambu bags of all sizes here. We have adult and pedi on each crash cart. There are difficult intubation supplies here. These are checked daily in the tackle box, and there are airways provided in the tackle box as well. So that's on the adult intubation tackle box. Also on the carts there are multiple flashcards if you felt like you needed some guidance. There's an extra roll of paper if we are running a code and we run out of paper, heaven forbid that, there's an extra roll. Also, in the recovery room we have an MH cart. On that is drugs that would be used to treat malignant hypothermia if that were to occur. It is in the refrigerator, and it does need to remain plugged into an outlet at all times. We also, in recovery, have a pediatric tackle box here. That is filled with all the supplies geared towards a pediatric patient. This is pulled out and set on the desk in PACU when we do have pediatric patients. We have airway supplies, IV supplies, and then we also pull a pediatric emergency drug box. Those are pulled out and left on days that we have pediatric surgeries to be easily accessible if needed. On the crash cart here, there are multiple sizes of pads for pediatric here and for adults. There are EKG stickers as well. There are CO2 monitoring devices for adults and for pediatric patients. Everything should be supplied here if needed to run a code. If you ever use any supplies, they do need to be replaced, or notify your manager for that.